Hi, this is Dr. Abdullah Khan, orthopedic surgeon, speaking from CarePoint Medical Center, Ras Al Khaimah, UAE. Today I'll discuss again a very important problem in our OPD, heel pain. Male, female patients are regularly reporting to us with this complaint, heel pain, usually diagnosed as plantar fasciitis. This is a multifactorial problem. Multifactorial degenerative phenomena, and there are some issues which are always overlooked, neglected while treating this condition, because we always target plantar fascia and heel, and we give injections there, and majority of the patients are really not responding to this issue. Why? Because it has not been properly investigated and understood. I'll discuss some of the reasons of this problem. Number one, I'll mention that there are some seronegative spondyloarthropathies in our practice which presents as heel pain. You will always see that these patients, they are complaining of morning aggravations of heel pain. They have some other joint issues, they have some backache issues also. Should be investigated on the lines of rheumatology and should be treated accordingly. Second, most important thing, sometimes backache also presents as heel pain. If you neglect that element coming from the sciatic nerve causing heel pain and you just inject the area, it is not going to respond. You can try any modality. There are plethora of modalities available to treat plantar fasciitis. Third thing is, which is very important, I would like to say that always look for deformities of the foot, because they are predisposing factors like flat foot, cavus foot. These are problems. They should be investigated and treated. Sometimes, flat foot, you address flat foot by properly changing some kind of a footwear and exercises, and problems is solved. The foot deformities should be taken seriously and should be addressed. This is one issue. Second is, it is associated with calf muscle tightness, soleus, tendocaides, gastrocnemius. These are the muscles sometimes responsible for pain. If this area is not addressed, it is not going to respond. I always say that it is usually in our practice, I have noticed that plantar fasciitis, flat foot, and tarsal tunnel syndrome with tight tendocaides is the reason. If all these 3-4 problems are to be addressed, only then you are going to give relief to patients. Regarding investigations, you don't get much. You always see spur. Spur you can get in normal people also. Who are runners, you will get. Sometimes you get some changes on ultrasound, but usually imaging is not going to have much, but lab profile is going to help you, because I have seen patients of plantar fasciitis are associated with vitamin D deficiency, increased uric acid, some kinds of infections, and spondyloarthropathy should be investigated on rheumatology line. From treatment standpoint, we have spectrum. I told you, you can try anything, but conservative treatment in the form of painkillers, addressing predisposing factors should be used. If patients are reconstrained, not responding to the conventional way of treatment, then we can go ahead with the PRP or injection steroids. These two things I am using in my practice, PRP and injection steroids, and they are responding very nicely if patient is investigated properly, as I discussed, from all the predisposing factors point of view, then patients are responding very nicely. You don't have to jump on surgery, because surgery in plantar fasciitis is not helping much. Therefore, my emphasis is proper investigation of all the reasons causing plantar fasciitis. Thank you very much.